Clinical Record Viewer Guidance. Welcome to this training video which demonstrates how to access the SystemOne Clinical Record Viewer. This will give you access to the patient's record, including information on medication, allergies, special patient notes, care plans and end-of-life information, which will enhance your patient care and your clinical decision-making. To be able to access the Clinical Record Viewer from SystemOne, you must use an NHS smart card. A local system administrator or registration authority agent should be able to facilitate this for you. Once you've successfully logged on to the spine using an NHS smart card, click on the SystemOne icon to begin. The SystemOne logon screen will appear. Click on the Log On with NHS Smart Card button. There may be several SystemOne units that you can access from this screen. Select the correct one for the environment you're in. In some cases, if there are outstanding tasks, a countdown will appear. Your SystemOne administrator will need to tidy up these tasks. SystemOne will then take you to the initial home screen. Click onto the Search magnifying glass button to search for a patient record. Perform a quick patient search by NHS number or name of patient using the first name, then last name, or date of birth entering numbers only, such as 170374 for the 17th of March 1974. Tick the Include Deducted box. In this instance, the patient is active within the hospital and has an open episode of care. Highlight the patient row and click Select at the bottom of the screen to retrieve the patient. If the patient is not found, click on the Not Found button. If the patient is not found, you will need to register them on the system. Search for the patient by using their NHS number whenever possible. Demographic details such as postcode, house number, road and patient's date of birth are to be visually checked and confirmed for accuracy. Highlight the patient row and click Select. You will now be prompted to record the patient's information sharing consent preferences. The patient's record should be retrieved and sharing preferences recorded. You must record consent correctly to view and share information from other care providers. Without the correct sharing preferences put into place, key information may not be visible within the patient's record. Recording consent. Consent to share out information. This screenshot demonstrates that the patient has agreed to have their information shared out from this service. This means that any information entered from within the service could be viewed elsewhere by other care providers such as community nurses, GP practices and others. Consent to share in information. The patient has agreed that the service can view other information relating to their healthcare record. This means that GP, community and other caring providers' information can be viewed within the retrieved record. On clicking OK, the sharing preferences are recorded and the record retrieved. The patient record will open on to the Patient Home screen. On the left of the screen, you will see the Clinical Tree column. This is the key way to navigate the patient record. What to look out for in the SystemOne record? Firstly, navigate to the Special Notes icon, sometimes referred to as SPNs. This will highlight key aspects of the patient and guide you where to look in the patient's record. If the SPN states End of Life Care or similar, look next at the summary view called C&P EOL Care Summary, denoted by a red star. Important information such as CPR status, preferred place of care and other key information can then be viewed and printed. Right-clicking onto the red star view icon will give you the option to print out the summary from within Microsoft Word. The printout can then be included as part of the patient's paper notes. If the SPN states frail older person, admission avoidance, clinical, other, look at the view called C&P Health and Care Summary and Plan, denoted by a yellow star. If the SPN states frail older person, admission avoidance or end-of-life care, see attachment dated day, month, year. This indicates that there is a summary view from a non-SystemOne practice. This document will provide similar information to the SystemOne summary view as shown before. For patients in non-SystemOne practices, there could also be useful information in the SystemOne view from community nurses and palliative care teams, so it's useful to also check the red star in SystemOne as well. You can access the medical problem list and drug history on all patients registered with a SystemOne practice by using the view C&P Medical Problems and Drugs View++. If the SPN states safeguarding or similar, look at the safeguarding information denoted by the small triangle icon. If you cannot see this, you will need to contact your system administrator to make it available for you. Now look at the view called C&P Safeguarding Screening View, denoted by the magnifying glass icon. Please note, if safeguarding information is present, contact your dedicated safeguarding nurse to make them aware of the patient following your local safeguarding processes. If there is no information available from within the SystemOne views, access the information in the summary care record. Once you've finished, close the patient record by clicking onto the green Save icon at the top of the screen.